So today I'm going to focus on the CLUC study, which stands for Chickens Living in Urban Coops. And as was mentioned, I'm a research assistant professor at the veterinary school primarily. I also work sometimes at the medical school. I am a veterinarian, and I do practice in the Boston area in a small animal practice a couple days a month. I have an MPH, and I also have a master's in comparative biomedical sciences, all of which I earned from Tufts, so I'm a triple jumbo. And I'm working on this project closely with Jessica Liebler, who's an environmental epidemiologist at the BU School for Public Health, and with Christy Smythe, who is she's sort of like the backyard chicken guru of Boston, in that people that own backyard chickens generally don't want to spend the amount of money that it costs to go see a veterinarian for their birds. And part of that is because most vets in urban areas don't see chickens. They don't know anything about chickens. They only see cats and dogs and maybe pocket pets or some exotic pets. So if you have chickens in the city and you're looking for veterinary care, you either have to drive like an hour and a half north to a clinic that has some experience, or you take them to an emergency hospital where they have an exotics veterinarian who really doesn't know much about chickens. They know a lot more about exotic birds. And then you're going to pay something like $200 to $500 depending on what you need done. So Christy is experienced with chickens, and she has partnered with Green City Growers, which they're here in Somerville, right, I think, at their headquarters. They do a lot of urban gardening, and they do a lot of the raised roof gardens, like the one that's on Fenway, and there's a Whole Foods garden that they also run. So she's partnered with them to offer services such as Coop Design and management, helping to build backyard coops. She'll do like a monthly flock management if you need help with that, which might include beak trimming and checking them for mites and making sure their feet look okay, and just basic husbandry and health services. So that partnership has been very fruitful in that we've had access to a lot of chicken owners in the area. For funding, so I'm going to talk a little bit about two components of this project. The first one was a pilot study we did where we looked at blood lead levels in chickens. So that was funded by the Tufts Institute for Human-Animal Interactions. And then we are currently receiving funding from the Tufts Clinical Translational Sciences Institute, CTSI, which has a pilot grant program that they offer each year. And I should also mention that I grew up with backyard chickens actually in Jamaica Plain, where we had an old house, and my parents, we had maybe like 10 hens and a rooster. And at the time, it was fine for a while, and then there was an election that came around for when Mel King ran for mayor, which is way before. Most of you probably won't. I will outdate most of you, but he was progressive. My parents put a sign up for him, and our neighbor didn't like it, so they called the cops on us. The cops came, and we had to get rid of all our chickens. It's very traumatic when I was young. So this project is really focused on looking at lead in the context of backyard chicken ownership. And you probably have some familiarity with lead and lead poisoning and lead toxicity, and it's definitely been in the news lately with the crisis we have learned about in Flint, Michigan, and their water supply. It is still an issue of national concern, and there have been amazing strides to reduce lead exposure and reduce toxicity, but it's still present in the environment, and it's still an issue. So the CDC estimates that 4 million households in the US have leaded paint in their house. And that's one of the most common sources of lead contamination in the environment is the historic use of leaded paint. They used to put a lot of lead in the paint because it helped keep the colors brilliant and it helped make it a more durable product. But when they started to realize that it actually has adverse and toxic health effects, they did place some bans on leaded paint use in 1978. So any house built before 1978 almost certainly has leaded paint in it somewhere. And the biggest issue with leaded paint is when it starts to actually chip. So when it starts to break down, it creates dust that can be inhaled and aerosolized, and then it will leave paint chips in the environment. So it's like you have this window where it's not really a problem, and then when you start to get the paint starts to chip, especially if it's in windowways or doorways where there's a lot of movement and friction, is when you start to see the lead coming out into the house or into the yard. So there's also 500,000 families in the US that have children between the ages of 1 and 5 that had a lead level that is above 5 micrograms per deciliter. This number changes quite frequently, and it's been coming down and down. So actually the Massachusetts standard is 10 micrograms per deciliter, but the CDC has recently reduced the nationwide standard to 5 microliters per deciliter. And if your child has a lead level above 5, that's when they recommend intervention. Depends on what blood lead level it is. It might be a home assessment to come and see if you can figure out where the source of lead is coming from. But if the child has a very high blood lead level, it might require medical intervention. Minority populations in lower income neighborhoods are at a much higher risk of living in lead contaminated environments. And this is largely because they usually live in the areas that are less desired and less upkept well. So they live in usually old buildings and rental units often that have a lot of lead that's, contaminating the environment around them. Sorry, that should say bans for paint, not pain. But they did ban leaded paint use in 1978. And then we also used to use leaded gasoline, and that was finally banned in 1996. So paint is one of the biggest sources of lead contamination in the US in the environment. Leaded gasoline is another big one. And so you can see correlations between environmental lead contamination and proximity to roadways and highways, and proximity to old gas stations that used to have leaded gas tanks. The newer gas stations, obviously, they don't have leaded gasoline anymore, so it's not as much of an issue. Yeah, so it's a big, it's pervasive in the environment, and it's unfortunate because it's a heavy metal, so it doesn't degrade. It just stays in the environment. It doesn't really go anywhere. And that's also really hard with management because it's hard to figure out how you can successfully remove it from the area, and then what do you do with it? In my opinion, I think that's a challenge too, because even if you just put it in a dump or something, then you're still contributing to this, environmental contamination of lead in a different environment. So this is just to outline the health effects that lead toxicity and lead poisoning can have on both children and adults. So in children, the symptoms can be very vague and nonspecific if it's a low level of lead exposure or contamination in their blood. Sometimes it'll be stomach cramping, just not feeling very well, and it can progress to failure to thrive. It can inhibit their ability to achieve their educational milestones. You can see developmental delays. There's a higher children who have lead exposure tend to be more likely to get ADHD. And it's something that can persist into their adulthood. It can also cause decreased renal function and can affect their hearing and speech as well. So it's really a big problem in children. The primary route of exposure in children is through ingestion because they're constantly either playing in the dirt in the yard or in the environment. They will often put things in their mouth, sample them, or their hands get painted, leaded dust or paint chips, and then they can ingest it that way as well. In adults, it has been more recently linked to adverse health outcomes, even at very low levels. So previously it was thought that the main adults that were really at risk for lead toxicity and lead poisoning were ones that were exposed to the occupational hazards associated with lead. So for example, people who do stained glass, there's a lot of lead used in stained glass. People who work in battery factories, construction where you're constantly tearing down buildings, demolitions that might have lead in them. Those types of occupations make you more prone to having elevated blood lead levels as an adult. But more work is showing that even low-level contamination in adults, as low as 10 micrograms per deciliter, is associated with an increased risk for cardiovascular disease. And the CDC has recently come out and said that there's no safe level. They have that 5 microgram per deciliter cutoff as a recommendation for when you need to intervene, but they don't think that 4 isn't a safe level. There's no safe level because more and more research is indicating that chronic exposure can be problematic. And please, if you have any questions as I go through this, don't hesitate to raise your hand or jump in. I'm happy to stop and answer questions as we go. I also briefly wanted to mention that in adults, it's much more common for them to get exposed through inhalation of dust. So when there's leaded paint dust in the air and you inhale it, it's almost completely absorbed into your system, almost at 100%. Whereas if you consume it, the absorption is at about 10% in adults, and it's at 50% in children. So children are much more susceptible as well to lead toxicity because their digestive system absorbs it at a much higher rate than adults do. This is just a map of our country, just to show you sort of the hot spots for environmental lead contamination. So the highest areas in parts per million in the soil are greater than 400 in this map, and you can see that we are right in this, very very high range. We are definitely in a hot spot for environmental lead contamination. A lot of this is probably due to the fact that there's a lot of historic old Victorian houses that were built, 150 years ago that are just loaded with lead paint. There is also some legislation in place to protect families that rent. If they live in an apartment that has leaded paint and their child has high blood lead levels, they can mandate that their landlord remediate. And that's actually a very expensive process that landlords really obviously are resistant to, but they have to do it. But they have to seal off the whole house to get rid of the paint. They can't just repaint, stand and repaint, so it's a big process. This, again, is just to highlight the fact that there's been a lot of awareness about lead and sources of lead contamination, and we're making good progress. So if you compare 1997 map here to 2011, the colors are kind of hard to see, but the darker red can show you the percentage of lead levels at or above 10 micrograms per deciliter as a percentage of the children that were tested. So you can see that it was quite high in a lot of states, and it's come down a lot down here by 2011. So we are making good strides in reducing lead exposure. And this is just, again, to outline some of the sources of lead. So I already talked about leaded paint, which is really the biggest issue, especially locally around us. Leaded gasoline can persist in the environment as well. Another source that maybe isn't as well known is that a lot of toys, candies, and cosmetics that are imported from Asia and some other international countries tend to have higher lead levels than stuff that you might buy locally. So it's always good to pay attention to where the product is coming from, and maybe worth investigating if there's any standards for lead testing of that product before it's sold to the consumer. And there are definitely acute examples of children that come in with neurologic signs that swallowed a piece of jewelry or a toy that was really heavily loaded with lead. Another, I think, frequently overlooked source can be glazes. So a lot of ceramic glazes, obviously the ones that are used to make products or glazed products for consumption don't have leaded glazes. But if you're using glazes that aren't for consumption, more for adornment or decoration, sometimes they can have high lead levels in them, especially if you're bringing in products from another country where it may not be regulated. Do you have a question? It's in the actual candy. Yeah. And there's a standard in the U.S. for like the amount of lead that is, allowed in candy. Even U.S. candy might have some lead in it, but the level is so low. Yeah. Any other questions? Yeah, so that's surprising. But so interestingly with the glazes, like there was a case report of a family that came back from Mexico with a beautiful vase, and they started drinking their orange juice out of it every morning as a family, and the whole family had lead, have really high blood levels of lead. So something to be aware of. Did I miss anything else? Stained glass, I already mentioned. So those are the big sources. So I'm going to shift over a little bit to backyard chicken ownership, which is becoming a booming industry. So the USDA has definitely they did a study in 2012 where they're seeing a huge increase in the number of households that own backyard chickens. And it's across the country, it's not just in this area. There's a lot more people that are engaging in this activity. And it's also becoming sort of popularized in a way that I think it's just encouraging people who may not have any idea what it's like to have chickens or know much about backyard chicken keeping to see it as a feasible and cheap way to get their own eggs, which in some cases it can be. But this is just highlighting, so this is Tori Spelling where she has her pet chicken in her arms. And this is, just to highlight that they really are sort of a pet and a production animal at the same time. And I think that's a difficult crossover to deal with, especially in this country, because there's really no regulatory authority over backyard chickens like there is over the commercial poultry industry. This is a designer chicken coop that Neiman Marcus sells for $100,000. I'm not even joking. And I think like 10% of it goes to a charity if you were to actually buy it. But yeah. So it's definitely gaining in popularity. There are some varying regulations as to the zoning that will permit backyard chicken ownership. In Somerville, you can get a permit. I think it's about $150. A lot of people don't actually do it because they don't want to spend the money to do it, and they don't really perceive that they need to, and that nothing seems to be enforced that well. In Boston itself, the regulations vary by municipality, so it depends on if you live in Roslindale or Jamaica Plain or Back Bay. And they're reflective of the age when we used to have horse-drawn carriages. So the regulations regarding production animals or livestock, they just really aren't applicable to backyard chickens. There's a lot of momentum and activation, people are trying to sort of iron out a path that's more clear to follow if you want to have some agricultural animals on your property. Boston and Somerville were separately named 2 of the top 5 cities for raising urban livestock in the country. And that was in I think that was in the Modern Farmer in 2015. So, you know, and they talk about chickens, and they also talk about goats and some other production animals. So what do we know about lead in poultry? So we know the lead is in the environment. We know that people that have backyard chickens usually let their chickens roam in the yard, so it's reasonable to presume that they would also be exposed to lead. And when you look into the literature a little bit, there are scattering, you know, a handful of studies here and there that touch on this topic. A lot of them are case reports where the chicken has neurologic symptoms, it ingested like actual paint chips, was pecking at a barn or something that was painted with leaded paint, and developed acute signs of toxicity. And then they investigate all the animals on the farm and they find that they all have high blood levels. There's a study in the lab that sort of looked a little bit at lead metabolism in chickens, where they exposed them to different levels of lead and tested where it was accumulating. So they found that it accumulates primarily in their kidney and their liver, a little bit in their soft tissue. It gets excreted in their feces. It gets excreted in their eggs, primarily in the shell and in the yolk. And then a lot of it gets stored in their bone, which is similar to what happens in humans. A lot of the lead gets stored in the bone over time, and it can get mobilized again when you're in a period of stress, such as, you know, in talking about a human, if you are breastfeeding or pregnant, if you're hypocalcemic, you don't have normal levels of calcium in your blood, or if you have osteoporosis, that can mobilize the lead from your bone and cause elevated levels again. So it's really challenging because if you have a bird that has a low blood lead level, you know, on day 1 and a high blood lead level on day 5, and it goes back down on day 3, it's really hard to get an accurate understanding of what the total body burden of lead is. So people are moving more and more towards looking at including bone, like looking at the density in bone or the lead concentration in bone to augment our understanding of what the total body burden is. And the way they're doing this in humans in the clinical setting is they have an XRF gun, which you can basically, it's like what they use, the inspectors will use them to determine the level of lead in paint. You can just point it at the wall and shoot it, and it will give you a reading. And they can also use that in bone. So they'll have, you know, shoot it through your femur bone to see if they can calculate the concentration of lead. It works for adults. It's really hard with children because you need to stay still for a long time. So there are challenges there as well. So we know that birds get exposed to it. We know they can develop clinical signs of it. And we know that it does go into their eggs. And there are correlations between egg levels and blood levels. And then there was a nice study that came out about a year and a half ago from New York City where they looked at chicken flocks in urban co-ops. So in Brooklyn, there's a lot of urban co-ops where they have a flock of maybe 10 to 15 birds. And all the people that have plots in that garden chip in and take care of the chickens, and they all sort of split the eggs that they get. And they found extremely high levels of, well, not extremely high. They found high levels of lead in the eggs as well as in the soil, which wasn't too surprising. But they modeled and decided that, you know, because every family that was a part of that community garden got maybe like 1 or 2 eggs a week for their whole family, that it was really diluted out by commercial eggs. No one was only eating those eggs because there weren't enough. So they didn't think it posed an actual risk moving forward. So we were interested in looking in this context because most people that have chickens in and around the Boston area use them for, you know, the sole production of eggs for their family, and sometimes if they have extra, they'll give it to their neighbors or colleagues. So over the summer of, I guess it was 2015, Dan Mordarski, who is right here, is a DVM MPH student who did his capstone project with me looking at blood lead levels amongst backyard chickens. So there's this really nice machine called a lead analyzer, which is a patient-side, bedside point-of-care test where you just need a very small sample of blood. You can run it through the machine and you can get a reading of blood lead level, and it detects anything between 3.3 micrograms per deciliter to 65. If it's above 65, it just reads too high to read, and if it's below 3.3, it reads too low to read. So you can get some measure of the concentration of lead in their blood as well as whether or not they have a high level or not. And so we really didn't know what we were going to find in this area, so we just did really a descriptive study. We were looking at enrolling as many flocks as possible and just randomly picking 2 birds per flock to try and test for lead. This is a map that actually Caroline Talmadge made here. She's been working with me on this project. But this shows all the different towns that we collected samples from. It's a little bit hard to see in this light, but I will just highlight that the shading here represents population density in people per square mile. The purple triangles represent the number of birds that we sampled in each area, and it's divided by zip code. And then the yellow circles are the average blood level per zip code. So you can see that in some areas where there's a lot of higher density of people per square mile, the birds that lived in those areas tended to have higher blood levels compared to the flocks that lived in more rural areas where they were less populated. Can anyone think about why that might be? Any ideas why we might see that higher blood levels in birds that live in more densely populated areas compared to less densely populated areas? I mean, I think there's a note. Do you have? Yeah, exactly. Yeah, there might just be a lot more houses with lead paint. There might also be less yard space for them to roam around in, and therefore their coop is closer to the house. So there are a couple of things that could be playing into that trend that we're noticing. This is just an overview of the flock and household characteristics from the 26 flocks. So we enrolled 30 flocks. We got surveys from 26 to look at some basic husbandry and management practices. And we found that the coops were split evenly as far as their distance from the home. 96% of all the coops had access to soil, and 69% reported that they let their birds roam in the yard for prolonged periods of time and quite frequently. Households knew that there was a history of lead use on the property. 62% had children that lived there and consumed the eggs. 100% of the people that had flocks consumed the eggs from their flock. 54% would use other products from the flock. That's in the form of, like, some people would collect feathers to make, to add to dream catchers or art projects. Usually the chicken poop is composted. The eggshells are often crushed and fed back to the chicken or put in the compost. And then very rarely people will slaughter their own birds for consumption. Sell or trade products, so 46% of the people also will sell or trade their products to their friends or their neighbors. 42% were aware of the potential for lead exposure in a flock, which I was happy to see, because I think when I talk about this research, every 85% of the time people say, wow, it's interesting, you consider lead contamination when you're thinking about growing vegetables, but you never think about it in the context of the animals that are also living on the property. And 19% reported that they had taken steps to reduce lead exposure in the flock. So moving on, this table shows you the average blood lead level of the hens stratified by different descriptive factors. And I also will point out that we definitely detected elevated blood lead levels in over 70% of the birds that we sampled. So if you look at human population density, the birds that were in more densely populated areas had much higher average blood lead levels than the birds that lived in less densely populated areas, and this approached significance at 0.05. Moving on to access to property, so the birds that had access to the property in that they could roam the backyard tended to have higher blood lead levels than the birds that didn't, although this was not statistically significant, and part of that may be due to our sample size, so we're hoping to be able to design research that looks into this with more power-driven approach. Coop proximity to home, we really did not see that much of a difference between the average blood lead level in coops that were close to the home versus coops that were further away from the home. For a known history of lead use in the property, again, the averages were pretty consistent across the board. But interestingly, in steps taken to prevent flock exposure to lead, it did look like the birds whose owners had taken steps to prevent exposure had slightly lower average blood lead levels than the birds that lived on properties where the owners hadn't tried any interventive measures to reduce lead exposure. Again, that's not statistically significant. This is just a trend in the data that we observed, so we'd have to investigate that further to draw any conclusions. And then this is a histogram that shows you blood lead levels in the population of birds that we studied. So there's a lot of birds that had undetectable or less than 3.3 micrograms per deciliter in their blood. But then they sort of spread out across the board. There was a huge concentration here in the sort of 0 to 20 micrograms per deciliter range. And then you have some outliers here that have really high blood lead levels. And then this graph here shows you a box plot of stratified by people per square mile density. So in areas that had more densely populated housing and people per square mile, you can see that the blood lead level sort of shifts up a little bit. So we started to think about what's actually happening. And this is a diagram we came up with to sort of walk through all the different routes of exposure for chickens. So starting at 1, we know that leaded paint is a big issue in the area and that it's leading to a contaminated environment, and that is probably something that the birds are exposed to. Interestingly, birds that run around in the yard, they love to eat anything that's moving, so they'll just pick out worms and insects, whatever they can get their beaks on. And if you look in the literature, worms that live in lead-contaminated environments bioaccumulate lead. So when they're ingesting worms in these leaded environments, they're also ingesting the bioaccumulation that this insect or worm has experienced. Very many people will feed their chickens oyster, as crushed up oyster, as a source of calcium supplementation. And oysters that live in lead-contaminated waterways also have lead accumulation in their shells. And then they peck away at whatever plants they can get their hands on, and there are some leafy greens especially that are more prone to sort of extracting lead from the soil and accumulating it as well. Then another source is we know that lead is excreted in the feces from previous research. The majority of people will compost the feces, put it in their compost, and then they'll take the compost and put it in their vegetable garden, which they may have put in a raised bed because they know that there's lead in the soil in their yard and they don't want it to go into their vegetables that they're eating. But then they don't consider that, you know, the chickens might be excreting lead in their poop, which is now going into their vegetable garden. Similarly, we know it gets excreted in the eggs and that it accumulates in the yolk and in the shell. People either feed the shell back to their chicken as a calcium supplement, so then now the chicken's getting exposed again, or they will compost the shells in their compost, which again goes into the garden. And these are all ways that can end up on the table. And so really the question is, you know, what is the risk to people who are consuming eggs in this context, and how do we quantify that? Where is it coming from? So what sources in the environment in this cycle actually have higher levels of lead, and where can we think about interventions if there need to be interventions? And what is the risk to children versus adults who live in households that have lead products? So we designed a study where we aim to enroll 40 flocks total. And we're doing an environmental health assessment of the property to test as many samples as we can for lead. And we're looking at soil samples, fecal samples, compost samples, eggshell samples, the eggs themselves. We're looking at the feed that the chickens eat and the treats as well that they're given. So there's also, with this growing backyard chicken industry, there's also more and more pet food products that are coming out specifically for chickens. And it's a huge industry with dogs. I'm sure you're all aware of like all the prescription diets you can get and all the different combinations of foods you can get. So this is moving in that direction a little bit as well. And Purina, for example, has a chicken feed that they market specifically towards the backyard context. And they put spices like turmeric. They put turmeric in the feed because it makes well, they say it's an antioxidant, so it's good for the chicken. I suspect they do it because it makes the yolks look more of an orange, darker orange yellow, which is perceived as a better egg to the consumer. But if you look at spices that are bulk imported from other countries, sometimes they have high levels of lead in them as well. And the treats range from anything from seed to scratch to sometimes bugs and mealworms, stuff like that. So this is one of my interns last summer who was helping me with the study, Allison. She's conducting an interview with Teresa here, who is the participant, who actually participated in the previous study as well and had very high blood lead levels in her birds. And she went through environmental remediation. So she pulled up all the soil below their coop and replaced it with clean soil. And then when she retested it, there was still lead. You know, a couple months later, they were still getting higher than you would expect levels of lead, considering she just replaced all the soil. So that's also surprising because that sort of creates or begs the question, how can you remediate the environment if you want to in this context? This is another intern that was working with me, Allison, so I had two Allisons. So they helped me collect samples. We were also looking for salmonella. So that's a better known risk of contact with chickens. But I don't think a lot is known about salmonella shedding in this context of the backyard chicken flocks, and also what the risk is to humans. Do they actually have a higher incidence of diarrheal disease than people who don't have chickens and constantly have contact with them? So we're beginning to explore this. We're just testing all the birds. So we're getting cloacal swabs from all the birds. We're getting a composite poop sample from the birds, and then we're getting a dust sample, because dust is actually a better indicator of salmonella shedding. Because if you get a fecal sample, there's a lot of it can get outcompeted by other coliforms and gram-negatives that are in the poop. In the dust, it tends to be easier to detect. So we're going to try and figure out what strains of salmonella are circulating in this context and how common it is to pick it up. It's a tough one, though, because we're getting one sample, and usually you need to get serial samples because they don't shed it daily, so that can be really intermittent shedding. We also are doing just a general health assessment, mostly as a service to the people who have chickens, because a lot of them don't have contact with vets. So we'll look the birds over and see if we have any recommendations for them. We'll look over their coop setup and see if we can, in a constructive way, say, oh, you could try this or you could try this. A lot of problems that we see are mites and also bumblefoot, which is a wound on the foot that's very hard to treat and get to heal. And what else? Yeah, that's it, I think. Christy's been helping us also with this and looking at the coops. This is, again, just collecting samples from the actual environment. This is actually a very nice coop setup, so there's a really wide range of what we're seeing as far as how people are constructing their coops. This one is beautiful. It has a raised roosting area that's indoors. It has an outdoor area that is fenced in. Hardware cloth is built 3 feet into the ground. One of the biggest problems that owners encounter when they're rearing backyard chickens is that it attracts rodents, and that can be really challenging to get rid of, and it can also really piss off the neighbors. So this is nice because it's really taken measures to prevent the access of rodents to the coop. The rodents come because they want to eat the food that the chickens have access to. Also, everyone will take all their compost and throw it in, into the chicken coop for the chickens to eat. A lot of people even throw their cooked leftovers in there because they really will eat anything. So that also attracts the rodents. This is, again, another coop that was built on the side of a garage. This is a coop that's interesting. I mean, it has this fenced-in area, the roosting area, and then it has these different layers of outdoor space that they can be permitted to roam or be enclosed in. I also saw one woman who had a home in Roslindale where she had a really beautiful treehouse that was elevated. That was for her kids, but they went off to college, so she converted it into a chicken coop. They have this really elegant, beautiful treehouse to roost in at night. Again, this is another example, and here you see the coop is just right next to the vegetable garden. They usually do fence off gardens to the birds themselves because they'll eat everything, but they do put the litter in the garden, as I mentioned previously. We're using a selective media to try and culture salmonella, and it's a stepwise process that takes 5 to 7 days, depending on if we get any growth. And so if the colonies, which are hard to see here, turn red, so some of these colonies are a bright red, crimson red color. You can see it here when we're rechecking to make sure we have an isolated colony. Those are highly indicative of salmonella. So then we're growing up those colonies, freezing them down, and once we have everything together, we'll do PCR to confirm it, and then hopefully sequence what we have to figure out what strains are circulating. I would say I don't actually have a preliminary number for you, but I'd say we picked up salmonella in probably over half of the flocks that we're testing from, which isn't surprising. I was not surprised by that. So, and I found no evidence of diarrheal disease in the families, especially the ones that seem to have salmonella in their flock. One thing that we quickly realized was that we were getting a lot of calls from middle to upper class, highly educated individuals who are really focusing on locally sourced food and trying to be as environmentally friendly as possible. And we really weren't getting any minority populations in our sample. So last summer, I designed a project with Nikki Smith, who was a MPH MBS, so Master's in Public Health, Master's in Biomedical Sciences student, to sort of dig into this a little bit deeper. So her concentration was in global health, and she couldn't go abroad for various reasons for her capstone project. So she focused on identifying immigrant communities that have interactions with live poultry. There's a lot of areas in Massachusetts where you have a lot of immigrant communities that come in, and it's reasonable to presume that, if they are accustomed to having chickens in their yard from the country where they came from, that they might want to continue this practice when they're here. And it's been challenging to access these people. mainly because we're not exactly sure which cultures would be engaging in chicken keeping and which ones wouldn't. So it was really just a lot of networking and phone calling. And I'll read you just a few quotes we got. So we were just trying to identify a few key informants to understand which communities we could target if we have a more culturally sensitive approach to that specific population. So here it says, I know many people in my community that keep chickens in their home, but fear the trouble that it would cause to speak about it. We prefer fresh chickens. We cannot get this except to keep our own. This was a gentleman who said that people kept chickens usually in their cupboards in their kitchen in this community because they didn't want to keep them outside because they were so concerned about drawing any extra attention to themselves as immigrants. And they would collect the eggs for a few months and then they would slaughter the bird for consumption. The Chinese community prefers undercooked chicken and chickens that are slaughtered and then kept warm. It's a very common cultural preference. We have to consider how this contributes to patterns of illness. There are multiple breaks in the system as it pertains to food safety because we can't monitor privately slaughtered birds. So you're probably aware of the live bird markets that they have in Somerville and also in Chinatown, but there's also a lot of live slaughter that goes on outside of these facilities, and that isn't in a facility that has any sort of oversight by the USDA. Our farmers enjoy keeping chickens like they did before coming here. It reminds them of something they did in Puerto Rico, and they enjoy it. They use chickens for eggs mainly, and then many will take the chickens home to kill and eat after a while. Most of the ethnicities have certain cultural preferences, again, pertaining to undercooked or fresh, warm meat. These preferences break down further into the differing nationalities amongst cultural lines. There are preferences for type of bird, part of bird, and how the birds are slaughtered. And then finally, one gentleman that I know operates a private slaughter service for his clients. It's frowned upon, and he's been serviced to cease and desist from the Department of Public Health, but it is a better business model for him because it meets the demands of his customers. These people prefer freshly killed, intact birds that are not refrigerated. So there's a lot there, I think, that would be very interesting to dig into further. And it just really comes down to sort of mobilizing some help and finding funding and really trying to target specific communities with a culturally sensitive approach to understand sort of how they keep chickens, how they raise them, what their interaction with them is, and if there is any risk to them as far as consumption of the eggs and or meat. This is just some very, very preliminary data. So this is from about 15 flocks. This is the lead concentration amongst backyard chicken eggs and flocks. So the blue is the backyard egg, and then the flock is the red here. So the great majority of the eggs and flocks have very low levels of lead, so that's 0.04 parts per billion. There are some up here that are quite higher, however, especially this one up here at 0.36. I'm also in touch with the lab about whether or not this is actually in parts per billion, because every time I've gotten eggs tested, it comes back to me in parts per million. So I'm wondering if this is a typo. So I'm just putting that out here so that you don't take home any major take-home messages, because I didn't hear back from them in time for this talk. But if this is indeed parts per million, then this would be, pretty high lead level. And we have just, the scattering of samples that I tested before actually diving into this larger scale study. I definitely did see some concentrations up in this range in the backyard flocks in Massachusetts, in Boston. This is looking at egg lead levels. So here I'm showing you the backyard chicken eggs. This is the flock average. And then these are store-bought eggs. So I just got some Pete and Jerry eggs from the supermarket. Notice the sample size here is 4, so that's very low. And again, the sample size here is 15, pretty low. This is 70, but still, so there's, don't draw any major conclusions from this data. You can see the maximum in the backyard chicken eggs went up to 0.343. The average was 0.042, and the minimum was 0.007. And again, the flocks, the average was a little bit lower, the average maximum, minimum, and total average from each flock. And then if you compare it to what we found in the store-bought eggs, you can see that there's really a drastic difference in the lead concentration in eggs that are coming from backyard chickens compared to eggs that are coming from store. That one type of egg from the store. Questions? There was a question online. Oh yeah.
I was wondering who spoke in the quotes that you were showing.
So I can't really say who.
Generally speaking.
Not
the name, but.
Yeah, so that's a good question. So some of those quotes came from community members, represent that, a community member of an immigrant population. Some came from people who had access to and interactions with or worked with that community. So it's sort of a range of people. This just shows the percent of backyard eggs here on the left
and the percentage of backyard eggs with a lead concentration that's 10 times the mean lead concentration found in grocery store eggs. So 44% of the eggs had a mean lead concentration, or had a lead concentration that was 10 times higher than what we found in the store-bought eggs. And then 53% of the flocks had a mean lead concentration that was 10 times higher than what we found in the store. This is moving on to looking at feed and supplements, and this is lead in parts per million. So we didn't see extremely high lead levels in feed, which is right here. So the maximum that we detected in feed was 9 parts per million. The average was 4 parts per million. If you look at the supplements, the maximum was actually 34 parts per million, which is high, and the average was 7 parts per million. This right here is the Canadian standard for the maximum allowable lead concentration in agricultural food products for the animals to eat. So, and I couldn't find a US standard. I need to see if I can find, dig around a little bit more. But you can just see this is way higher than you know, what is recommended for these animals. This high number, I have to go back and look, but I presume a lot of it is coming from the oyster shell supplements. And then this is showing the percentage of feed samples that were above this 8 part per million level, and the percentage of supplement samples that were above this 8 parts per million level. So it's definitely more of a concern in looking at the supplements that they're getting. And finally, this is just a quick look at the soil samples. So over here we have lead in soil within 10 feet of the home, lead in soil further than 10 feet from the home, and then lead in soil from the coop or enclosed outdoor area. The majority of coops, they're on the ground. Even if they dig down, you know, to try and make it more secure, they usually are on a plot of soil for the property, from the property. And so I have here the number of samples we had, the geometric mean, because it was not an evenly distributed sample, and then the minimum lead concentration, the maximum lead concentration, and then the percent that exceed the mass standard of 200 parts per million is what they recommend. That lead above 2 parts per million is not safe and should warrant remediation depending on what you're planning to do with the soil and prevent access to children. And then the percent that exceeded the EPA child plate standard of 400 parts per million. This standard didn't take into account a study that came out that showed even blood levels of 10 microliters, that blood levels of 10 microliters per deciliter in children were associated with soils that were at 400 parts per million. So they might bring this recommendation down. But just to highlight, we got a wide range. So the maximum lead concentrations was up in the 2000s for some of these samples. And, you know, some of it was below what the EPA standard is, but right at where the average was right at where the standard is in Massachusetts. So definitely there's widespread lead contamination, which wasn't surprising. Moving forward, we hope to sort of look at this data in relation to the lead concentration of the eggs and also of the feed samples. And then we also are hoping to correlate this, look at, you know, use GIS to look at proximity to roadways for the environmental samples and sort of geospatial factors as well that can account for rainfall and elevation and whatnot. So we're still, like I said, this is very preliminary data, very small sample size. So we're still working on it. We're pretty much done for the season because the birds stop laying usually over the winter, although I did find one woman who has lights that she puts in the winter, so they'll keep laying. She also was raising 7 turkeys in her property, like right next to Route 9 in Newton, which was pretty amazing. She had like a whole farm there. And but yeah, so we'll be up and running again this coming summer, and I'll open up the floor to any questions, and please, you know, don't hesitate to reach out to me if you have to go and you have questions. I'm happy to discuss further as needed. So thank you.
Thank you very much for a nice presentation.
Oh,
Yes,
thank you.
President from the Environmental Studies Program. If anybody has any questions,
Yeah.
I'll go around the room.
Hi, thank you very much. I have 2 questions. I'm just wondering you said when the lead can get mobilized from bones, if it's already been there, how is that discerned? Is it a blood test? Can you do a blood test and see that?
Yeah, I'm not sure. So I think they will follow people over time that they know have had exposure to lead. And usually if you like ingest a large quantity right away, your blood lead concentration is going to go up really high. And then slowly the half-life, you know, it gets excreted from your body or deposited in your tissues. And so a lot of it will get deposited in your bone. And then when you go into any sort of osteoclastic process where your body is mobilizing calcium from your bone, it'll also release the lead back into your blood. So you'll see your blood levels go back up.
Okay, all right. And then the other question I have is, if people are keeping chickens, how often would you recommend they test the chickens themselves for their blood level?
So that's a really good question. I think especially the preliminary study we did, which I forgot to mention, all of the birds were asymptomatic, so not a single one of them had any clinical signs that would have led the owner to think that there was anything wrong with them. So I really think it is something that veterinarians who see chickens should include as standard of care for every health check. Mm-hmm. We did find, another thing that we found was that there was huge variability amongst the same flocks. So one bird would have a really high level and one bird would have a level that was virtually zero. And we're not really sure why that is at this point. It might have to do with when the calcium is being mobilized. Maybe one bird likes to peck more at paint chips or the side of the house than another bird. It could be individual behavior. So I think I would recommend doing it if you have detected a high blood level, to follow up every 6 months or so to get an idea of what's going on. Okay. But there's no standard for that, so it's sort of a hard question to ask. But Teresa, the woman I talked about, she's been getting her birds tested as well, and her blood levels in her chickens have come down, but they still are like going back and forth, up and down a little bit. So it's been very challenging for her to sort of figure out a way to, and she's invested a lot of money in this. I mean, that's the other thing that you have to consider is that, when you're talking about environmental remediation and vet bills for getting your chickens tested and your eggs tested, it suddenly becomes something that's not maybe that cost effective anymore.
Right. Okay,
Yeah.
thank you.
You mentioned that, oh, sorry. So you mentioned that about 19% of people who you went, and that was part of your study, took steps to mitigate their risk for lead poisoning for their chickens. What were those steps, and what do they do?
So that's a good question. So calcium supplementation in the form of primarily oyster shells is one thing that's in the literature that is indicated that helps to decrease absorption. But if they're eating calcium, if they're getting a calcium supplement that's loaded with lead, then that's another question. But the other thing a lot of people will do is they'll restrict access to areas of their property that have high lead levels, or they will expand sort of the footprint of the outdoor run that's enclosed for their flock and replace the soil and make sure it's clean soil, or even put it in a raised bed and not let their chickens roam around in the yard. So those are the two main things I've seen people do.
Okay, thanks.
You showed that lead levels in commercial eggs are much, much lower than in backyard raised chickens. How do commercial and backyard eggs compare in other ways?
That's a good question. I don't know too much, as far as nutritional content, I don't know. I think there's a wide range. I know the commercial poultry industry, they have regular checks for things like salmonella, and I think they do regularly check for lead as well. But I'm not really sure as far as which is a healthier egg. It's generally thought that the backyard chicken eggs are more nutritious, a better nutritional quality to them, but I don't know.
There's a question online.
Has there been any discussion with municipal officials in either Somerville or Boston yet about this study, or is there any plan to do that?
So I have reached out to Somerville officials, and they helped send a letter of recruitment to all the people they had on file that had permits. And there has been some informal conversation, and I'm hoping to sit down and reach out to the Massachusetts Farm Bureau as well. But I kind of want to wait and see what is actually happening before I do that, because what I really don't want to do is scare people and make it seem like backyard chicken ownership is not healthy, because I really am pro backyard chicken ownership. But I think it's maybe more of a matter of awareness. I think that people need to be aware that this could potentially be a problem. And when we really know what's going on, when we get all our data in, we can try and come up with some recommendations that would be feasible and hopefully helpful as far as reducing exposure to lead in this context. And I also really need to figure out, what I said, was that data in parts per million or parts per billion, which will change everything. So, yeah.
I was just wondering if you could talk more about calcium supplementation. I know that when I was involved with the Childhood Lead Action Project in Rhode Island back in the 90s, they were talking a lot about calcium supplementation, the importance of that in reducing human exposure. And it sounds like there's some complexities to that with chickens, but are you talking about this with the backyard owners, that they could be supplementing?
Yeah, and that's another aspect to consider, is that, you know, people themselves could be supplementing with calcium or even iron, because I think that your body will preferentially absorb those over lead. So that's another thing to consider, that, you know, they could be making sure they're giving their birds clean calcium supplements and taking them themselves. And I'm also very curious to look a little bit further into, like, can we identify, you know, a certain number of households that have children between 1 and 5 and a certain number of households that don't, that, you know, both groups have backyard chickens, and then can we look at blood lead levels in the children to see if there's any major difference we're seeing, although it gets challenging because, you know, obviously the people that have a lead-contaminated environment, regardless of whether or not they have chickens, probably their children will have elevated blood lead levels compared to a household that doesn't. So, and I have talked to some pediatricians that work at Children's in the lead remediation unit, and he was kind of like, wow, I never considered this. I can't say I've ever specifically asked anyone when they bring their child in that has a high blood lead level if they have chickens, but no one's ever told me that they have them. But he was going to start asking, sort of as part of a screening, just to see if he was seeing any indication that was an issue with children. So, but a lot of people, they consume, like, I definitely am finding that people consume a lot more eggs than I expect. Like, they'll say that they consume between 2 and 4 eggs a day when they own chickens because they have so many of them. So that's a lot of eggs. So even if it's a really small, you know, concentration of lead, we're hoping to model it so we can figure out if the cumulative risk is, you know, is concerning or not.
If there are no other questions, I have one quick last one. It seems we still have a lot of research going on in this area. Do you have any opportunities for students to get involved?
Yeah, definitely. So I love getting students involved with research. So if you're interested in this project, please reach out to me. You know, there's a number of different levels in which I could foresee involvement, ranging from just helping with fieldwork, if that's what you like, to, you know, getting involved in the lab, or even if you want to carve out your own piece of what we're doing as like a thesis project, I'm open to that. So definitely let me know, reach out. My contact information, it's marieke.rosembaum@tufts.edu, the standard email. So. Thank you very much. Thank you.